This was an excellent event of ITECH presenting the project and the action plan on M-Health and E-Health. So for me it's really important because these recommendations are really critical for our job. This means that they are relevant, they know exactly where we're lacking with legislation, and the Commission is following up on what they suggest. So I think that we have to have this platform and keep tracking what's going on and try to be forward and to have the foresight on what is planned also by the market.
ITECH is pointing the real problems we are facing in France and in Europe. It has proposed a lot of solutions for perhaps an ITECH 2 phases, especially on the way to assess clinical innovation around software in the e-health field.
I think it's very important to spread the telemedicine possibilities all over Europe, because it's something that at the beginning could take some more time for as an investment, but in future this will cut a lot of costs and will improve the benefits of the patients and also for the doctors that are seeking for a second opinion.
ITECH recommendations, I believe, are really good, especially the ones around training. We definitely need more engineers and technicians trained about health technologies and able to bring up on the market even new things. But also, I think that training for people in the ministers, in the health authorities is also very important, so that they better understand the benefit of those technologies. So I strongly believe that trainings about the ability to evaluate the benefits of new therapies, of new technologies for patients and for the society in general is very important. So for me, that's certainly the key recommendation from ITECH.
I very much appreciated the ITECH recommendations. I particularly liked the 12 gaps identified, which I think were very pertinent. And I think what really is the important next step for ITECH is to make sure that the regulators and the policymakers and the payers and ultimately also the users, be that patients or doctors, understand what those gaps are and help the health technology companies in overcoming those gaps. From my perspective, from a patient organisation, key to that is making sure that the end users, whether it's a patient or a doctor, is part of building the solution. Because if you build a solution without involving the end users, you could potentially waste a huge amount of energy and time.
We need to build solutions according the regulation, but also the needs of the patient, and bring technology to the close to the patient at home. So I think that's building this kind of solution will be the next step for us and for the entire industry.
I guess that some more meetings like the one today would certainly be helpful. So educating more and more people of the European Parliament and Commission is certainly going to be very helpful. I also believe that with the help of Europeans, some more visibility of health technology should be given to a large audience like patients. A lot of patients have actually absolutely no idea of what those new technologies are, maybe because some of those patients are old and not necessarily very aware of what's up today. But I strongly believe that advertising those new technologies and the benefits they bring to the health would certainly help those new technologies to be able to grow up on the European market.
In my opinion, the next steps are that the European deputies take the recommendation for us and concretize the recommendations to have a real important market and very competitive to US market.
What we can expect is that ITECH will not stay at this stage. I am not sure that there will be an ITECH 2, but I am sure that ITECH propositions, ITECH recommendations will help to build new actions in education, in regulation, in clinical trials, and in the definition of taxonomies and nomenclatures.
I think it is very interesting because we have now politicians, parliamentarians, the Commission, and people from the market trying to work together. I do believe that this is a huge chance and economic growth also included in e-health, but also it's about healthy aging, which improves citizens' life and the quality of the citizens' life. So by all means, we'll try to have the legislation needed, not too much, but not too little, to protect citizens, and also to be able to allow the market and the innovation to happen, because we are good at research, we have the funding, but now we have to fund the market to create this innovation and not to have the brain drain from EU to other countries. So it's an excellent project and we will be following it. Thank you very much for having me here.